Good morning, everyone, and welcome. My name is Jenny McCaffrey, and I'm the training lead with the Invasive Species Council of BC. The Invasive Species Council of BC is a collaborative-based organization committed to reducing the spread and impacts of non-native species within BC. I'm joining you today from East Vancouver, and I am so grateful to live and work on this land, the unceded traditional territory of the Squamish, Musqueam, and Tsleil-Waututh First Nations. And I just want to thank all of you so much for joining us today for this webinar, which is co-hosted by the Integrated Vegetation Management Association of British Columbia and the Invasive Species Council of BC, entitled Glyphosate Myths and Facts. So this webinar is being recorded and will be available on the IVMA and ISCBC websites shortly, probably tomorrow. But if you are hoping to qualify for the credit, please participate in the entire webinar, including the quiz that we'll be sharing at the very end. At this point, I am pleased to give a warm welcome and introduction to Gwen Shrimpton, who's the Executive Director of the Integrated Vegetation Management Association.
As Jenny mentioned, this webinar is co-hosted by the Integrated Vegetation Management Association of BC and the Invasive Species Council of BC. The IVMA is a recognized organization dedicated to the responsible practice of vegetation management throughout the province. Our membership represents diverse industries, including forestry, gas, electrical utilities, railways and highways, and invasive plant management. The IVMA is the credit coordinator for the Ministry of Environment Continuing Education Program for the recertification of pesticide applicators for the forestry, industrial vegetation, including noxious weeds and aerial categories. You must be a member of the IVMA for us to track your credits. Information on this program can be found on our website at ivma.com. We plan to enhance the opportunities for obtaining credits by holding webinars. And as Jenny mentioned, this webinar qualifies for 1 credit. You must provide us with your pesticide applicator certificate number when you registered for this webinars and stay for the entire presentation, including the quiz at the end, in order for you to obtain your credit. So at this time, I am delighted to introduce our webinar speaker today. Darell Pack is the Director of Provincial Regulatory Affairs and Stakeholder Relations for CropLife Canada. In his role, Pack is the contact point between provincial governments and stakeholders and the association. Prior to joining CropLife Canada, Darell worked for the federal government for more than 30 years, 25 years with agriculture and agri-food, and most recently, he was the Director of Regional Communications, Media and Consultations at Agri-Food Canada. Darell holds a political science degree with a minor in French from the University of Lethbridge. So welcome, Darell.
Thank you very much. Appreciate the opportunity to be here and to talk about an issue that's certainly been in the news quite a bit recently, continues to be in the news, essentially titled "What's Up with Glyphosate?" The active ingredient in what's commonly referred to as Roundup. And welcome the opportunity to have this chat. And I was excited to see the various pins showing up on the map, because I grew up in Southern Alberta and I lived in Saskatoon and Winnipeg and Ottawa 3 times. So when those pins started to pop up, that was exciting to see. For those of you that may be wondering who CropLife Canada is, we represent the Canadian developers, manufacturers, and distributors of pest control products and modern plant breeding. So you'll see on this slide the logos from our member companies, from large multinationals to a company such as Okanagan Specialty Fruits in BC, which you may recognize as the developer of the non-browning Arctic apple. So we have a number of an interesting mix of companies that we represent. And what do we do as an association? We increase awareness and understanding and acceptance of the benefits, safety, and sustainability of plant science innovations. We want to see legislation that is clear, that assists and encourages science and industry innovation. We strive to be world leaders in life cycle stewardship of pest control products and plant biotechnology traits, including things such as empty pesticide containers. Our sister organization, Clean Farms, which some of you may be familiar with, has been collecting empty pesticide containers, expired pesticides, and expired veterinary medicine for 20 plus years now, and so we're proud of that affiliation. And we strive to work with stakeholder groups, to have alliances with them in order to have sound public policy within this space. And the environment that we work in has certainly changed over the last number of years. We're all familiar with how traditional media has really been decimated. The old models of delivery and consuming news has been turned upside down. We have a new model, niche communications. It's customized, it's online, it's delivered 24/7, and it constantly needs to be refreshed. And unfortunately, with that also comes fake news, which is in some areas quite rampant, and with little or no fact checking. Traditional media prides itself on fact checking, on sourcing, etc. And what we see now in some environments is certainly not the case. And groups can deliver their messages cheaply, efficiently via targeted advertising on social media, and again with limited or no fact checking. So, cue the outrage when it comes to glyphosate, and there are various groups out there, various organizations, initiatives, activities that target glyphosate. For example, those of you in BC are probably familiar with Stop the Spray BC, sister organization in New Brunswick. We work with stakeholder organizations in New Brunswick as well. And it's interesting how when you do a quick look at the Stop the Spray BC social media accounts, has 600 followers. So not a lot of followers, but yet able to influence the discussion. And it's a discussion that we welcome because we think it's important to have that discussion. And when you look at some of the things that show up, and this is from Stop Spraying New Brunswick, where they have found a correlation between the amount or the increase in glyphosate spraying in the forestry sector with a decrease in the deer population. Or at least that's how they present that. And about a year ago, I was kind of intrigued by that, and so I went to the Government of New Brunswick website in their natural resources area to find out if there were restrictions on deer hunting in New Brunswick, just so that I was better informed on this. And what I found out, there were 2 areas of the province where there was restricted deer hunting. And interestingly, neither of those 2 areas were forested areas in New Brunswick. So, we can find correlations, but as a former colleague of mine regularly beat into my head, correlation does not necessarily equal causation, because if it did, we would be aware of increased per capita cheese consumption, which is a direct correlation to the number of people who have died from becoming tangled in their bed sheets. So when you search for data, for information, it's relatively easy to find correlations. And if you're interested in more of that bottom slide, you can just go to spuriouscorrelations.com and find all kinds of entertaining information. So, but how did we get here, particularly in the last few years? The International Agency for Research on Cancer, which is an organization within the World Health Organization, back in 2015, placed glyphosate on its group 2A as a probable human carcinogen. Now, IARC has done hundreds of monograms over the years, and what they do is it's an exercise in evaluating cancer hazards. What does that really mean? Well, the 5 classifications that IARC uses, from group 1, which is a known carcinogen, all the way down to group 4, which is probably not a human carcinogen. And so they say they placed glyphosate in group 2A. But let's take a look at some of the other substances that they've placed within the known, the probable, and the possible human carcinogens. So we can see that in group 2A with glyphosate, there's emissions from frying, there's shift work, there's red meat. In group 1, which is the known carcinogen, we can see asbestos, alcoholic beverages, for example, and processed meats. So I find it interesting that in some jurisdictions that are actively considering banning the use of glyphosate, there's limited, and that's probably being generous, but no discussions on maybe we should ban alcoholic beverages and processed meats as well, because they're known carcinogens. So what can we learn from that, and how do we see the IARC classifications as being part of the discussion? And probably one of the best ways to describe that is just through this infographic on what is a hazard versus a risk. We can see that a hazard is something with the potential to cause human harm, such as driving on the road. Sunday night, we had our first, I guess, semi-major snowfall event in Ottawa for this winter season, where driving on the road would have become a risk as opposed to a hazard, because we would have been driving in wet snow, blowing snow. For 20 years, I didn't have facial hair, and COVID kind of pushed me to, maybe it's time to bring back the beard. So I used to shave every day. Well, that's a potential hazard. But if I went out into the woods and tried to shave a bear, there's a real risk involved in that. And you can see from, using a hair dryer, there's a potential hazard, but you probably shouldn't use a hair dryer in the bathtub. So, but looking at a hazard versus risk, we look at from regulatory agency point of view. And so what did Canada's Pest Management Regulatory Agency have to say about the IARC finding? Well, as they said, it's important to note that a hazard classification is not a health risk assessment. The level of human exposure, which determines the actual risk was not taken into account by IARC. And as PMRA said very clearly, pesticides are registered for use in Canada only if the level of exposure to Canadians does not cause any harmful effects, including cancer. So they do a much, I guess, a deeper look. They look at the data, what's the exposure levels, what would somebody in a real life situation potentially be exposed to, and does that cause a risk? And if it does, PMRA will not register that product for use in Canada. They've been very, very clear on that. But let's look at some facts around glyphosate. And we'll come back to this in and out of the presentation. It's been around for 40 years, 40 plus years now. It's a well-established safety record. It's been widely adopted, not just by Canadian farmers, but farmers around the world that want to prevent weeds from stealing water, nutrients, and sunlight from their crops. And it's an important tool for weed management and forests, as you're very much aware, and urban spaces. Regulatory agencies around the world, three world leaders, when talking about regulatory agencies, more often than not, the European Food Safety Authority, United States Environmental Protection Agency, and Canada's Pest Management Regulatory Agency are often referred to as in the top three. And these three organizations, along with other regulatory agencies, have all, some of which have recently reevaluated glyphosate, have all come back and said that this product does not increase the risk of cancer when used as intended. And in fact, there's the Genetic Literacy Project has developed this infographic, which is really small on the screen, and I apologize for that, but it's small on the screen because it's quite a lengthy document that lists several of the regulatory agencies around the world. And I know the moderator is going to put the link to this infographic in the chat, so you can access that while I'm speaking. But they listed regulatory agencies that have recently reviewed glyphosate, and what have they said about it with respect to the carcinogenic nature of glyphosate. And none of the 160 have indicated that that there's a risk of cancer when used as directed on the label. So that's important. And in fact, those three main regulatory agencies that I mentioned, again, PMRA found that products containing glyphosate do not present risks of concern to human health and the environment. The EPA said it's not likely to be carcinogenic, and the European Commission said that there are neither scientific nor legal grounds to justify a ban on glyphosate. But certainly others, and rightfully so, we should all be concerned about what's in our food. I mean, I don't have children living at home anymore, but I have grandchildren. And so that's one of the, I'm always concerned about what they eat as well. And fortunately in Canada and in many other countries, we have regulatory agencies such as the Canadian Food Inspection Agency that regularly tests food products for pesticide residues. And in 2016-17, they specifically tested for glyphosate residues in barley, beans, including chickpeas, lentils, peas, soybean, wheat. And what they found was that 98.7% were in compliance with the maximum residue level. Now, of course, we would all like to see 100%, but 98.7% is approaching that. And they found that no samples of fruits and vegetables, soy products, infant formulas were found to contain residues exceeding Canadian limits. So that work continues. We encourage that work to continue so that we can all be assured that what we're eating is within the Canadian regulations. But as I mentioned, it's certainly possible to detect glyphosate residues in foodstuffs. With the testing technology that we have now, we're able to test to the parts per trillion. And I had it explained to me once, when you're looking at like a part per billion, for example, if you had a roll of toilet paper large enough to extend between New York City and London, England, a part per billion would be one sheet of that toilet paper. So when you're looking at parts per trillion, it's even smaller than that. But just because something is detected doesn't mean it's dangerous, because we're surrounded every day by things that could potentially cause us harm. And the Swiss regulatory agency, what they put out in their report was that someone would have to eat 655 kilograms of bread produced with the most loaded wheat on a daily basis to even approach the acceptable daily intake of glyphosate. I like bread. I don't like that much bread. But then it got personal with me. Ben and Jerry's ice cream. Then they came after Ben and Jerry's, and there was an organization in the U.S. back in 2017 commissioned a study on Ben and Jerry's ice cream, and they found that and the chocolate fudge brownie, which is kind of one of my favorites, was the most loaded one. But interestingly, as they started their public campaign to force Ben and Jerry's to go organic, interestingly, they did not quote the executive director of the independent research laboratory that they had commissioned to do this study. Because this is what he had to say about that. He said a 75-pound child would need to consume 145,000 8-ounce servings of Ben and Jerry's chocolate fudge brownie every day to hit the EPA safety limit. And for adults, jumps to 290,000. Now, I like Ben and Jerry's, but I suspect if I lived on a Ben and Jerry's diet, I would die from scurvy before I died from glyphosate exposure to the food. So everything needs to be kept in context. Again, just because it can be detected doesn't mean it's dangerous. But we see in the news various lawsuits that have been filed, particularly in California, in the US, and most recently Bayer, which now owns Roundup, the trade name Roundup, They have been able to, through mediation, strike an agreement that they will settle these cancer suits within the U.S. And for those of you that are familiar with how the California, I guess it's civil lawsuits tend to go, this is the way it goes. There are things that are brought forward that force, in many ways, companies to just go, look, it's better to try and come to a resolution to this rather than continue on with the lawsuits, because each and every lawsuit that has been filed has been reduced on appeal. Appeals continue on, and that system is just, it is what it is. But it's interesting that when science is on trial, that the results tend to be different. And as many of you are aware, California has its own regulatory agency for pesticides, so they can apply additional restrictions over and above what the US EPA applies, and also through a ballot initiative in California several years ago. If a product or something within a product, whether it's the heavy metal that's used in cell phones or other electronic devices, if it has been determined to cause cancer, then by law, a sticker needs to be placed on that product before it can be sold in the state of California. And so with the IARC decision, there were organizations that pressured the California Regulatory Agency to proceed with affixing a cancer sticker to glyphosate containing products. And as the case went through the courts, a federal court judge put a permanent injunction on the state of California, saying that they could not affix that sticker to glyphosate products because the science did not support it. They had not proven a cancer link. So what do we learn from some cases that have been successful and this science-based case that wasn't successful? At the end of the day, we're surrounded by things that could potentially cause us harm. So read the labels, manage the risk, and don't give in to internet science. Be careful on everything that we do. Now I have a glass of water sitting next to me in case my throat goes dry, and as long as it stays in that glass and I sip it up through my straw, there's nothing wrong with that. If I accidentally spill that glass on my hardwood floor here, and I don't wipe up all of it, if I stand up and slip on it, then I've created a risk that's going to be dangerous for me. But as long as that water remains in the glass and goes in my mouth through the straw, I'm fine. So that's what our main message is: read the label, follow the instructions, and keep yourself safe. So there's a lot of information out there to help you to follow the science, to understand the different court cases that are going on. So for example, and again, this link will be placed in the chat box, you can go to the Bayer website and learn about where they're at with the various settlements, lawsuits, the things that they are doing to try and move this forward. And also Bayer has a very good information site on glyphosate itself. What do you want to know about it? There are 4 different categories on that particular website: the role of glyphosate in agriculture, environment and biodiversity, health and safety, and an extensive frequently asked question section. And I just want to talk just briefly on the environment and biodiversity, and actually it's a link to agriculture as well. As I mentioned, I grew up in southern Alberta, and for any of you that have been in southern Alberta, it's windy. And growing up on a farm, it was not unusual to see topsoil blowing off the fields in spite of the best management practices of the day to try and stop that. But over the last just over 20 plus years, with the introduction of minimum till and no-till agriculture, soil health has improved dramatically. And glyphosate-based products are key to minimum till and zero-till agriculture. Without those products, that just wouldn't be possible. And so soil health has been increasing through the judicious use of these products all across the country. So there are benefits. Again, use it as directed, and when and where you should use it. And in the forestry sector, I guess an area that you're very familiar with, probably more so than I am, but we've been working with organizations across the country, BC, New Brunswick, Alberta, to better understand the issues around glyphosate use in the forestry sector. And within BC, there's 57.2 million hectares of harvestable forest land. And on an annual basis, 200,000 hectares are harvested in BC, which is 0.35% of the BC forestry. And of that 200,000, 50,000 is old growth forest, so 0.09%. And why do I mention that? Well, BC is recognized as a global leader in sustainable forest management. So herbicide use, typically glyphosate, is often the most effective, efficient, and reliable method to regenerate conifer plantations. And it reduces certain worker health risks, including physical injury from equipment. And what's important to note is that each regeneration area, so that 200,000 hectares that are harvested annually, 0.35% of the forestry, that area is potentially could be sprayed with glyphosate in the regeneration efforts, but typically it would only be used once, at most twice, over a 40 to 80 year rotation period. So the amount that is being used is minimal, and it's being used after looking at what is the best option in order to assist in this redevelopment of the forestry sector. So it's, like us here, I had an interesting conversation with. We have a province-wide urban pesticide ban, certain pesticides in Ontario. But if you have things like, poison ivy, poison oak, a couple of other noxious weeds on your property, you can go to your local Lowe's, Home Depot, Rona, whatever, and tell them that you've got this issue, and they will walk you to a locked cabinet. They'll unlock the cabinet. They will sell you glyphosate, Roundup, for example. And a year ago, my next door neighbor, his backyard looks like the abandoned Jurassic Park. So I'm getting all kinds of nasty things in my backyard. And so I went and purchased some Roundup. And I said, this is kind of silly, this behind a locked cage. And the clerk looked at me and just simply said, well, I understand that it causes cancer. And that presented an opportunity just to have a conversation with this individual and talk about the safety regulations in Canada, how things are gone through Health Canada in order to be approved for use in Canada, and pesticides will not be approved in Canada if there's any indication that they cause cancer. So it's one conversation at a time that we can hopefully have with individuals. So what have we done at CropLife Canada to supplement other information that's out there? We've established our own section on our website. What's the story about glyphosate? Again, that link will be put in the chat box to talk about, again, those things that what are the facts, what can we learn, and direct readers to information that if they wish to go a little deeper into that. So again, we talk about 40 plus years in the marketplace, one of the safest and most effective pesticides that's ever been developed. And in fact, glyphosate, when you really get down to it, has a lower toxicity than some of these products that are commonly consumed within our own households. Table salt, caffeine, vanilla, and vitamin D3 all have higher toxicity levels than glyphosate. When glyphosate is up for renewal, and in Canada, pesticides have to be reevaluated on a 15-year cycle. So every 15 years, a pesticide will be reevaluated. And Health Canada, through PMRA, recently completed its reevaluation of glyphosate in 2017 after a 7-year exhaustive study of the data, including independent studies that they would have looked at to determine whether they should or could re-register that product for use in Canada, which they did. Information on the 160 regulatory agencies around the world that all agree that glyphosate is safe when used according to label directions. Information on, again, what the Environmental Protection Agency in the US found when they did their reevaluation. And also what I think is really important, over the last 20 plus years, there's been a long-term study that was begun in the United States by the National Cancer Institute. It's called the Agricultural Health Study. And they don't just look at pesticide exposure, they look at a number of health impacting activities that would happen on a farm, like, for example, farm accidents from falling off farm machinery, or not having the appropriate guards in place around moving farm machinery. And one of the things that they do look at is pesticide exposure. And for more than 20 years, they followed over 50,000 licensed applicators, pesticide applicators. These would be the people with the greatest potential exposure of pesticides. And there was no association found between glyphosate-based herbicide use and cancer. So this study continues, it hasn't stopped, and it will go on for, I suspect, as long as we're around. So why do we do this? Why is this important to us? Why does it matter? Are we adding to or losing tools from our toolbox to attack invasive species? The fewer tools that one has, the greater the risk for resistance issues, because you want to be able to use an entire suite of products to attack the same problem so that resistance doesn't develop. Because when you start to lose tools in your toolbox, you have unintended consequences. And 2 or 3 years ago, for example, Europe instituted a ban on neonic treated seeds, the neonicotinoids that, and as a result of that ban, the farm minister in Great Britain, a couple of years later, he said, actually, that ban increased pesticide use. And the pesticides that were now being used to take care of those invasive species that were attacking the crops were more damaging to beneficial insects, for example, because they were broadcast foliar sprays as opposed to targeted pesticides that were on the seeds. So we want to make sure that there are no unintended consequences of bad science and politics informing bad public policy. So in a nutshell, that's what I came to talk about. There's a lot of things there to unpack, and I've tried to go through it relatively quickly, but not too quickly, so that we could leave time for questions. And again, I've welcomed the opportunity to have this discussion with you, and hope that we can get into more of a dialogue with the questions. So I'll turn it back to Jenny, who I'm assuming will moderate the questions that have been showing up in the chat box.
I will. All right. Well, excuse me. Sorry. Thank you so much, Darrell, for an excellent presentation. I feel like I learned a lot, and I was grateful for the inclusion of Ben and Jerry's in that presentation, which is very near and dear to my heart. I'm going to start with the Q&A, the first question in the Q&A box. And just as a reminder to everyone, I have seen questions coming into the chat, but please, if you'd like your question to be addressed, make sure it's going into that Q&A box at the bottom of your screen. Hopefully, if you have any problems seeing the questions or writing into that box, send our tech team a note and they'll fix that for you. So I'm going to just work my way through those questions until we reach 10 a.m. So we do have about 20 minutes here in Pacific Standard Time. And so if you do see your question already being asked, remember you can upvote it by clicking on the thumbs up, and we'll know that that's a really important question. So as I mentioned at the beginning, if there is not enough time to address all the questions, we will be sending those out via email. All right, let's see here. So I'm going to open up our Q&A chat. All right. Oh, Kate. Hi, Kate. From an invasive species perspective, can you please explain the potential risks to environmental health outside of human health? So in particular, the impacts on water systems.
Sure. No, thanks. And I should mention that Danielle Soulard, one of my colleagues at CropLife, who's our science officer there, is online as well. So the more difficult questions, I'll just defer that to Danielle, because after all, I'm an arts graduate. No, but no, seriously, thank you for the question. And when you look at, and I was just looking in some of the other comments as well, like any pesticide or any product that we're using, that's why when it's approved according to the label instructions. So the label itself is a legal document. And so when PMRA does its evaluation, they will look at the impact on the environment. They will look at the impact on human health. And so they take all of that into consideration. And that's why there are rate usage that's on the label, that you use a certain amount over a certain area. And if you follow those instructions, then as PMRA, in their language, that it's an acceptable risk. And so we don't want people to use more than the label says, because that will have an impact on the environment, or potentially have an impact. And so when you look at the label, that will give you the direction that you need to minimize the impact on the environment, on human health, and be able to address the invasive issue that you're addressing.
Great, thank you, Darrell. All right, I'm going to move on to the next one here. Everyone is definitely getting into the thumbs up, so that's fabulous. Thank you. We have 20 thumbs up on this question from Jamie. Can you please speak to the possibility of a cumulative effect of glyphosate on the landscape over years or decades? Does it remain in the soils and accumulate in the animal food chain?
Yeah, no, good question. And glyphosate is one of those products that has a very short, I guess, shelf life within the soil. It dissipates quickly, and again, it's one of those areas that PMRA looks at and tries to look at how long does it persist in the environment. Because the longer something does, then there is a potential for a cumulative effect. And with glyphosate, it is one of the products that has a much shorter shelf life within the soil.
Thanks, Darrell. All right, so moving on to Catherine's question. Any recent research on effects of long-term low-level exposure to glyphosate?
I'm not familiar with the most current research that's available, but what I can say is, I guess, referring back to what I said in my presentation, is that PMRA studied glyphosate over a 7-year period when they were doing their reevaluation process, and they would have looked at things like that. as they have said very, very clearly, if there's any indication that a product, whatever the pesticide is, has the potential to cause cancer, for example, or other negative impacts on health, they just simply won't register it in Canada. And they were asked by a handful of organizations to take another look at that, because these organizations said, well, since you did your reevaluation, additional things have come up. For example, some may have heard of what's been referred to as the Monsanto papers, different things like that. And so PMRA said, okay, send us all the information that you have that you think we didn't take into consideration, and we will take a look at it. And they assigned 15 scientists within PMRA who had not had anything to do with the reevaluation decision for glyphosate, and asked them, one, to take a look at the process that PMRA used to arrive at its reevaluation decision, and two, to take a look at all of this additional information that these organizations had sent in. And when they completed that review, they issued, put out a statement validating their 2017 decision, and indicating in that statement, in fact, the words that they used was that PMRA had left no stone unturned in its evaluation of glyphosate. And they ended, and as a former communicator in the government of Canada, I would have loved to have been able to write a statement like this, because it was very unequivocal. They said at the very end, they said no regulatory agency in the world believes that glyphosate is carcinogenic at the levels currently being used. So they were very definitive on that. And so we're an organization, we're a science-based organization, and we follow the science. If PMRA at the end of the day looks at a product, and after thorough evaluation says, here's some additional information that we found, we'll follow the science. We can't say on one hand that we're going to support PMRA on their glyphosate decision and not support them on another decision that we might not think is right. So I have faith in our federal regulators. I know that they work hard at this. As a former public servant, I appreciate the public service that they provide.
Great, thanks, Darrell. All right, we've got a question from Winona. Do you have any information on whether glyphosate is harmful to bees, not lethal, but just disruptive to their life cycle?
Yeah, it's important to note that glyphosate is a herbicide. It's not an insecticide. And so, the human physiology, or even the insect physiology, in the industry, it's referred to as a mode of action. And you're, I'm sure, very familiar with that. But how does a product, how does a product do its job? And so glyphosate is targeted towards vegetation. And everything that I've read from the experts that I have access to is that the insects and humans, for example, they don't have the receptors that glyphosate attaches itself to. So, when it comes to bees, for example, like anything, if you drench bees with water, they're going to drown. If you drench them with a pesticide, whatever, whether it's a herbicide or any herbicide, if you drench them, it's going to have an impact on them. But glyphosate is not something that, from what I understand, it doesn't show up in the pollen. It doesn't, it attacks the growth receptors on plants, and that's how it does its job.
Great, thanks for that, Darrell. All right, we are working our way through here. We've got lots of great questions. The next one is from Peter. Hi, Peter. Has CropLife seen the work done by Dr. Lisa Wood at UNBC on glyphosate residues in non-target plants after treatment has occurred in forestry blocks? Are there any plans to address these results or comment on them?
I'm not specifically familiar with that study, be happy to. My email address is at the end of the presentation. I know they're going to send the PDF version of the presentation around. Danielle, I'm not sure whether you're familiar with that specific research, but if you want to send that to me, I'd be happy to take a look into that and get back to you.
Great. Thanks, Darrell. All right, moving on to Kate again. Have there been any credited studies about the impacts of glyphosate through trophic levels?
You'd have to explain trophic levels to me. Maybe Danielle, anything on that?
Hi, everybody. Hi, I'm Danielle. I don't know off the top of my head of any studies right now on glyphosate through trophic levels, and Darrell, that would be like moving up through food chains.
Got it. Thank you.
Yeah, on hand, sorry, I don't have any studies.
But I guess just simply maybe on that reinforce that one part of my presentation where Canadian Food Inspection Agency regularly takes a look at residues, what's in the food that we eat. Are they approaching levels that we need to be concerned about? So that work goes on as well. But if you have something specific, a specific study, again, I would just invite you to email me that, and we can see what we can find out.
Great, thanks, Darrell. All right, so we are moving on to Jessica's question. Why do you only address health risks of cancer? What about other health risks like autoimmune diseases that have all been on the rise in correlation with the use of glyphosate use and GMO products?
Yeah, good question. I guess the reason we specifically talked about cancer is because that's the one that's in the news the most. But the same, I guess, the same evaluation process that PMRA followed, for example, to look at all of the potential health impacts of glyphosate or any other pesticide would also apply. If there was any indication that there were concerns in that particular area, PMRA has a number of options available to them. They can change the application rate on the label. They can ban the product. They can change when the product could apply, or just, as I said, simply say, yeah, we've now determined that there is this specific health concern, therefore this product is no longer approved. So PMRA has looked at all of the potential health impacts that could come from any particular pesticide that they're evaluating. I simply focused on cancer on this one because that's the topic that normally comes up.
Great, thanks, Darrell. And I just want to do a quick comment because I'm noticing there's lots of activity in the chat. And if you do want to send a message to all attendees, just make sure that little highlighted blue bar doesn't say all panelists. It has to say all panelists and attendees, and you can change that by clicking that down arrow. Similarly, I see some people with their hand up. Please write your question into the Q&A box or your comment into the chat because we don't have the ability to hear audio from our audience at the moment. So I'm going to move on to the next question and let everyone else pop their info into the chat and the Q&A. So this is from Iola. Did the reevaluation change the determination that glyphosate did not travel through the soil? For example, applied to a plant, goes to the root, kills the plant, stays in the plant.
I can't speak to that specifically, but there were some minor use restrictions that were changed on the label, but in general, however glyphosate was used prior to the reevaluation beginning, it can continue to be used in the same way.
Great, thank you. Moving on to a question from Robin. Is the best option to have a monoculture forest stand across a landscape that has many other land uses and values to other stakeholders other than the forestry sector? Is it necessary to use glyphosate to control deciduous vegetation that are an important part of the ecosystem that other species and ecosystem functions rely on?
Yeah, I'm not trying to dodge the question, but I'm not responsible for forestry policy in BC. What we strive to do is whatever forestry policy is adopted, we want to be able to make available products that allow that to happen in the safest and most environmentally friendly way.
Thanks, Darrell. I feel a part 2 coming on.
Yeah.
All right, next question is from Karen. With data that glyphosate is not related to cancer, why do companies pay out in lawsuits regarding health, as payout gives the optics of guilt?
Yeah, no, yeah, thanks for the question. I mean, absolutely. And it, I mean, I can't speak to why Bayer made the decision that they did, aside from what they have publicly said, and that's available on their website. But you know, we can go back to many cases that you know, I can remember. For example, I was just listening to a podcast from Malcolm Gladwell a while ago, and that's why it's top of mind. But the silicone breast implants, you know, at the end of the day, and all of the research that has been done, there was no linkage to cancer and those implants. But at the time, it was a significant, you know, public health concern, and I understand that. And the company just decided it's not a question of how do we make this go away, but it's how do we address the issue and help people get through this challenge that they are facing. We don't minimize the impact, the health impacts on these individuals that are bringing these cases forward. They obviously have some health challenges, and they're real. And what caused them is not for me as a non-medical professional to say. And so how do we do what's best? And that's what the companies are looking at. But I can't speak specifically to why Bayer is making the decisions that they are, but certainly can see the how this can be viewed.
Great, thanks, Darrell. We have about 4 minutes left, so we're going to try to address as many questions as possible, but a reminder, we'll send out the answers in an email if we don't get to your question. And there will be a quiz that must be completed for the credit, which we will open up after the question session. So let's try to get 2 more here. Have there ever been, Jacqueline asked, have there ever been any studies looking at glyphosate's effects on soil microbes or the human microbiome?
Yes, absolutely. And I'll give you I guess a real life example. A year or so ago, there's a parliamentary committee in Quebec that took a look, that studied pesticide use in Quebec agriculture. And one of the witnesses that appeared before the committee was a farmer who was one of the first implementers or first adopters of minimum till agriculture in Quebec. And he went through the first half of his presentation talking about how over the 20 plus years, his soil health had improved. And one of the indicators is the presence of earthworms in the soil. And then halfway through his presentation, he said, I would not have been able to accomplish this without the use of glyphosate to support my minimum till agriculture. And I haven't met this farmer, but I know an individual who has met him and took a representative from the David Suzuki Foundation to this farmer's farm in Quebec to just study what he was doing to improve his soil health. And he just gave the individual from the Suzuki Foundation a shovel and said, you go anywhere in this field that you want. I'm not going to tell you where to go. You go anywhere you want. You dig up a shovel full of dirt, and I guarantee you will find earthworms. And then that's exactly what happened. So he uses the product according to the label instructions. He does all of the other best management practices that are important to do that. And he can demonstrate, he's kept all the statistics for over 20 plus years of how much the health of his soil has improved.
Great, thanks, Darrell. I think that's related to, I'm going to get one more question in here, and I see two that are very, very similar, and everyone's upvoting them. So I think this is linked. It's from Terry, and Terry says, one of my main concerns is about those who don't apply herbicides according to the label and how this might impact pollinators, amphibians, and coho through stormwater pollution. Are there any comments on this?
Yeah, absolutely. That's an excellent question. And in all of our discussions with, you name the stakeholder organization, we have a consistent message, which is follow the label instructions, because applying pesticides in a greater amount than the label requires, all that does is take money out of your pocket and potentially damage the environment. And growing up on a farm in Southern Alberta, the last thing, one of the last things we wanted to do was spend money on pesticides. Nobody likes to buy pesticides. Nobody likes to apply pesticides, at least in my group of farmers and other individuals, because it's money out of your pocket. But there are times when pesticides are required in order to save your crop. And so for those that, for whatever reason, decide to over apply pesticides, they're losing money and they're not being very environmentally friendly. So our message is clear to everybody. Use it according to label directions, only use it when necessary. So apply the right amount, the right time, and the right place.
Great, thank you so much, Darrell. All right, we have reached 10 o'clock, so I'm sorry that we're gonna have to cut the other questions, but we will respond to them in email, and we'll take a look at the chat as soon as this is over as well, because I know there were some questions asked in there. So just a reminder, we are going to open up the quiz, at this time. Please click on the link in the chat to access the quiz. It will be open until 10:30 a.m. And if you would like CEC credits, you must complete this quiz. If you cannot access it, send our tech support a message and we can email that to you directly or send it in a private chat. So I just want to say thank you again, Darrell, so much for joining us today and sharing your expertise. And on behalf of the Invasive Species Council of BC and the IVMA and all of those that are listening, thank you so much. We will be sending out a short survey, a little evaluation about your experience today to all participants. So we'll send that in an email along with answers to the questions, etc. So please fill that out so we can get your feedback for future webinars and ideas. And if you're not already a member of IVMA or ISCBC, please check out the links in the chat to learn more. We're going to pop both of our websites in there so that you can learn more if you're interested. Thank you so much, everyone, for joining us. We really appreciate it, and have a wonderful day.
Thank you again. I really enjoyed it and be happy to come back anytime.
Thanks, Darrell.